Constipation after 60 is one of those problems people rarely talk about, but many quietly live with. You may tell yourself, my digestion is just slower now. Or, as long as I go eventually, it must be fine. Or maybe you have been dealing with bloating, straining, hard stools, and that uncomfortable feeling that your body just is not emptying the way it used to. And because it feels private, many people normalize it. But constipation after 60 is not always just aging. Sometimes it is a signal from your gut that something in your routine, diet, fluid intake, medications, movement, blood sugar, thyroid function, nerves, or bowel coordination may need attention. That does not mean you should panic. Constipation is common, and many times the reason is simple. But common does not mean meaningless. And the first mistake many people make is thinking constipation only means not going for several days. That is only part of the picture. You can have a bowel movement every day and still be constipated if the stool is hard, dry, painful, difficult to pass, or if you feel like you have not fully emptied afterward. Constipation is also about straining, bloating, pressure, discomfort, and changes in what is normal for you. That last part matters. What is normal for you? Some people naturally go more often. Some go less often. But if your pattern changes, if bathroom trips become painful, or if you start planning your day around your bowels, your gut may be asking for a closer look. To understand why constipation happens, think about what your body has to coordinate. Waste has to move through the colon. Stool has to keep enough water to stay soft enough to pass. The nerves and muscles around the bowel have to work together. Your meals, fluids, medications, movement, sleep, stress, and daily routine all influence that process. When stool sits in the colon too long, the colon can absorb more water from it. That makes the stool harder and drier. Then it becomes more difficult to pass. Straining begins. Bloating builds. The abdomen may feel heavy. Some people lose appetite, feel sluggish, or become irritable because the discomfort is always in the background. Over time, constipation can stop feeling like a small bathroom issue and start affecting your whole day. One common reason this becomes more noticeable after 60 is less movement. Many older adults sit longer than they realize. Joint pain, balance, worries, fatigue, surgery, illness, long car rides, or simply a quieter lifestyle can reduce daily activity. And when the body moves less, the bowel may move less too. This does not mean you need intense exercise. It does not mean pushing beyond what is safe. A gentle, regular movement matched to your health and ability can be part of a healthy bowel pattern. Another major piece is fiber. Fiber helps add bulk to stool and supports regular bowel movements. But many adults over 60 may get less fiber than they used to. Meals may be smaller. Appetite may change. Chewing may be harder. Cooking may feel like more work. Convenience foods may replace fruits, vegetables, beans, and whole grains. Still, fiber has to be handled wisely. The answer is not always, just eat more fiber immediately. For some people, suddenly adding a lot of fiber can increase bloating or discomfort, especially if fluid intake is low or if there are other digestive issues. A safer way to think about it is this. Fiber may be one helpful part of the picture, but it should usually be increased gradually and thoughtfully, especially if constipation has been going on for a while. Fluid intake is another important factor. When the body does not have enough fluid, stool can become harder and more difficult to pass. This can be especially relevant after 60 because thirst signals may not feel as strong as they used to. Some people also drink less on purpose because they worry about nighttime urination or bladder urgency. But fluid advice is not the same for everyone. Some people have heart failure, kidney disease, or medical instructions to limit fluids. So the goal is not to force large amounts of water. The goal is to ask whether your fluid intake fits your health situation. Medication is one of the biggest reasons constipation gets overlooked. Many adults over 60 take more than one medication, and constipation can sometimes be a side effect. Pain medicines, especially opioid pain medicines, are well known for this. But other products can contribute too, including iron supplements, some calcium products, certain anticides, allergy medicines, some antidepressants, some blood pressure medicines, and other medications. This does not mean your medicine is bad, does not mean you should stop taking it. The safe question is simple. Could any of my medications or supplements be contributing to my constipation? That one question can be very helpful, especially if constipation started after a new prescription, a dose change, a new supplement, or an over-the-counter product. Another factor many people overlook is delaying the urge to go. It sounds simple, but it matters. Some people feel the urge and ignore it because they are busy, away from home, embarrassed, traveling, or uncomfortable using public restrooms. But when stool stays in the colon longer, it can become harder and more difficult to pass later. For many people, the bowel likes rhythm. A regular morning routine, enough time, privacy, and not rushing may help the body respond more naturally. This is not a cure for every cause, but it is a pattern worth noticing. Constipation can also be linked to medical conditions. Diabetes can sometimes affect nerves involved in digestion. An underactive thyroid may slow body processes and contribute to constipation. Neurologic conditions, pelvic floor problems, bowel coordination issues, and other health conditions can also play a role. This does not mean constipation means you have one of these conditions. It does not. But if constipation is new, persistent, or getting worse, especially along with fatigue, weight change, weakness, numbness, blood sugar changes, or other body signals, it is worth asking your doctor about. Now, one of the most useful things you can do is stop asking only one question. Instead of asking only, how many days has it been? Ask, what has changed? Is the stool hard, dry, or lumpy? Are you straining? Is there pain? Do you feel blocked? Do you feel like you are not fully empty? Did this begin after travel, surgery, illness, a new medication, less movement, or a change in meals? Has it been going on for weeks? Is it affecting your appetite, sleep, energy, or daily comfort? Those details tell a much clearer story than frequency alone. And there are certain signs that should not be ignored. Constipation should be discussed with a healthcare professional if it is new, persistent, worsening, or lasts longer than a few weeks. It should also be reviewed if it comes with rectal bleeding, blood in the stool, black stools, unexplained weight loss, persistent abdominal pain, severe bloating, vomiting, fever, or a major change in bowel habits. If you cannot pass stool or gas and you have significant pain, swelling, vomiting, or severe discomfort, that should be treated more urgently. And blood in the stool should not automatically be blamed on straining or hemorrhoids without medical guidance. Sometimes the explanation is minor, but it should not be guessed. If constipation begins after a new medication or dose change, it is worth contacting the prescribing clinician or pharmacist rather than trying to handle it alone. There are also practical habits that can help you understand your pattern and support better bowel health. These are not cures and they do not replace medical advice, but they can give you useful information. Start by tracking your pattern for a week or two. Write down how often you go, whether the stool is hard or soft, whether you strain, whether there is bloating or pain, and whether anything changed in your meals, fluids, movement, medications, or supplements. This simple record can turn a vague complaint into a much better conversation with your doctor. Next, look at your meals honestly. Are you eating regular meals? Are you getting fruits, vegetables, beans, or whole grains? Has your appetite changed? Are dental problems, loneliness, nausea, budget concerns, or difficulty cooking affecting what you eat? Constipation is often treated like a bathroom problem, but sometimes the pattern begins in the kitchen, the medication cabinet, or the daily routine. Hydration is also worth reviewing within your personal medical limits. If you are drinking less because of bladder concerns, mention that to your doctor. Sometimes the conversation is not about drinking a lot more, but about timing, balance, and what is safe for your situation. Movement matters too. For some people, gentle walking, standing breaks, or simple daily activity may support bowel function. But the right kind of movement depends on your balance, heart health, joint pain, breathing, and overall condition. Bathroom routine can also make a difference. Give yourself enough time. Do not rush. Pay attention to the body's natural urge. For some people, the morning is the most predictable time, especially after breakfast. But every person is different. And be careful with repeated over-the-counter laxatives, cleanses, or detox products. Just because something is sold without a prescription does not mean it is right for every older adult. Some products may not be appropriate for certain medical conditions or medications. If constipation is persistent, painful, unusual, or connected with warning signs, medical guidance is safer than guessing. This is especially important for older adults who take multiple medications, have kidney disease, heart disease, diabetes, neurologic conditions, a history of bowel surgery, unexplained weight loss, or ongoing abdominal symptoms. A few common beliefs can also cause problems. Constipation is not always fixed by more fiber. Fiber may help many people, but constipation can also involve medication effects, low fluid intake, inactivity, pelvic floor coordination, nerve issues, thyroid problems, diabetes, or other medical conditions. Constipation is not only about how often you go. Hard stool, straining, pain, bloating, and incomplete emptying matter too. And constipation after 60 is not something you should automatically accept as normal. It is common. But a new or changing bowel pattern deserves attention. The main lesson is this: your gut has a rhythm. When that rhythm changes, it is worth asking why. Maybe the reason is simple: less movement, less fluid, less fiber, a routine change. Maybe it is medication related. Maybe it is connected to another health condition. Or maybe it is something your doctor needs to evaluate because the pattern is new, persistent, painful, or linked with warning signs. You do not need to diagnose yourself. You do not need to panic. But you do need to notice the details. How often are you going? Is the stool hard or painful? Are you straining? Do you feel fully emptied? Has anything changed in your meals, medications, supplements, fluids, or movement? Is there blood, black stool, weight loss, vomiting, fever, severe pain, or a major change in bowel habits? Those questions matter. Because after 60, constipation is not something you have to silently endure. It is a body signal. And like many body signals, it becomes more useful when you stop dismissing it and start observing the pattern. The goal is not fear. The goal is awareness. Awareness helps protect your comfort, appetite, sleep, energy, confidence, and daily life. So if constipation has become part of your routine, do not simply accept it as just aging. Pay attention to the pattern. Review the possible contributors. And if it is new, persistent, painful, worsening, or linked with warning signs, talk with a qualified healthcare professional. If this helped you understand one more body signal after 60, subscribe for more.com, practical and trustworthy health education for older adults. We explain the changes many people notice but do not always understand, without fear, without hype, and without confusion.